Hi, I just wanted to chat with you a few minutes about week 4 and what's coming up this week. We're about halfway through the material now, and I'm sure that you are feeling somewhat overwhelmed at the amount of information that you're gathering, and it's okay. Uh, these are difficult chronic type situations, and it takes some practice, and it takes getting some years under your belt to feel anywhere near comfortable working with these kinds of clients. Um, so give yourself plenty of grace. Know that you have good resources. This is one of the best textbooks I have ever seen on working with psychotic disorders or psychiatric disorders. Um, and the chapters are so detailed and they give you so much practical information. So please be sure that you're delving into those and also that you are checking into your DSM-5 and becoming at least somewhat familiar with the symptoms and the treatment of um, of each of these disorders. It's important for you to be able to distinguish between the different disorders and also to be able um, to diagnose your client. Um, I really like that the textbook has case studies at the beginning and at the ending. And as you are writing your own case studies for the I Can Start treatment plan or model, please refer back to those because they will give you a really strong idea of what we mean when we say clinical language and what's important to include and what maybe doesn't need to be a part of your treatment model. Um, this week you're going to be diving into some of the trauma related diagnoses, and so obviously we're only going to skim the surface of these. And addictive disorders, and we're really not going to spend a whole lot of time other than your reading on that. Most of you will probably either have already or will be taking the addictions class where you'll get some more in-depth um, uh, coaching on how to work with addictive disorders. And then the personality disorders, which often are the ones that we're most apprehensive about tackling. And so you're going to spend some time this week looking at those different personality disorders, which there are 3 clusters of personality disorders. The first one is paranoid, schizotypical, or schizotypal, and schizotypal. I will get that out. And schizoid. Those those disorders usually manifest with some weird or eccentric behavior. Um, the the um, um, the folks who think that um, uh, the conspiracy theorists, the folks who think that someone is out to get them, um, someone is following them, someone can read their thoughts, those kinds of things. So it's some kind of behavior that is, or thinking that's out of the norm. The cluster B is where you're going to focus for your assignment this week. And that includes antisocial, borderline, histrionic, narcissistic. Those are the ones that you're going to encounter most often. And of those, probably borderline and narcissistic are going to be the ones that you might encounter more often than others. I do want to caution you that uh, saying that someone is a narcissist has become almost a buzzword in our culture. uh, we all have narcissistic tendencies. And being able to discern when someone really has narcissistic features that are interrupting or are causing problems in their relationships in their day-to-day life. Um, uh, and when somebody is maybe self-centered, but uh, uh, they're not aware of it. They don't have a clue, and they're willing to learn. There's a difference there too. Um, you see um, a lot of emotion and a lot of chaos in cluster B, which is why we're asking you to focus on containment this week. How will you engage with a client who maybe is escalating emotionally, and you want to give them the opportunity to express what they need to express? At the same time, you don't want the emotion to overpower them to the place where they are lost in the emotion. So that's where you're going to focus your role play this week. Cluster C is the avoidant, dependent, obsessive personality disorders. This we see a lot of anxiety and a lot of fear here. Um, and again, notice that when we are talking about personality disorders, someone can have some uh, uh, obsessive compulsive traits, but not have an obsessive personality disorder. This is why it's so important that we are familiar with the distinctions and diagnoses in the DSM and in working with clients. It's also important that you know that, particularly with these personality disorders, but with others as well, we have the option to do a diagnosis of other specified personality disorder or unspecified personality disorder. And what this means is that we can, if a client doesn't meet the criteria, all of the criteria for a diagnosis in a particular area, we can do other specified personality disorder. And basically what that means is that we're going to say client meets certain symptoms. I'll be observing, or our therapist will be observing for additional symptoms as therapy progresses. And client does not meet item 4 in the diagnosis. And so what that means is that you specify why you're not giving the full diagnosis to the client. The unspecified personality disorder really means that you say this client has a number of criteria that meet the personality disorder, but you don't explain why you have chosen to give the unspecified. So you don't cite particular symptoms that you're not seeing. So just be aware that you do have the option in personality disorders and in some other areas of doing either an other specified diagnosis or an unspecified diagnosis. You have another quiz this week, and if you have problems, if you have questions, I sure hope that you will shoot me a text and ask me, and I will look forward to seeing you next week in our week 5 virtual class. I've posted some resources for you underneath my instructor's video for this week. And those are the PowerPoints that the textbook authors give us for each of the chapters, and a couple of other things that I think just might be interesting to you as we delve into this really exciting area of the work that we do, but also a challenging part of the work that we do. So as you read, also keep in mind the character structure for each of these um, disorders, because most of them will start in early childhood. Their development will start in early childhood. Also important to note that as of the writing of this DSM-5, there was not a lot of empirical evidence about treating personality disorders, and there was some discussion of even eliminating those from the DSM-5. But there was enough criteria that authors, the team that put together the DSM-5 felt like it was really worthwhile to leave them in and to continue researching them. So thank y'all for taking a few minutes to listen to me. And I hope you are having a great week, and I will talk to you later. Bye-bye.